All attendees are in listen-only mode.
Good morning. This is Michelle Smith with Texas Action for Healthy Kids, and I want to thank you for giving us your time this morning to hear about the legislation that passed during the 84th legislative session. And I'm really excited to have all three of our top key state agencies with us today. We have Jaclyn Cantu with the Texas Department of Agriculture, Barney Fudge with the Texas Education Agency, and Anita Wheeler with the Texas Department of State Health Services. So we appreciate them sharing their time and information to help you at our schools be better prepared to implement any new legislation that has taken place during the last session. If you have questions during the webinar, you may go ahead and enter them in the question box that you see should have on your dashboard screen. And just so you know, this is being recorded, and we will send out the link, and as well as any resources that our speakers share with us today. So probably sometime later this week or early next week, we'll get that link out, and we'll get you those resources out as well. So I want to get started, and let's see. I believe my first presenter is going to be Jackie, and let me just change over. Okay, and Jackie, you now have control. And you will need to hit show my screen, I think. There we go, and unmute yourself.
Good morning, everybody. Thank you for having me. I'm Jaclyn with the Texas Department of Agriculture. Just wanted to give you some updates on what's going on with our agency, with what's passed in legislation. First thing I think I need to start off with is that our programs are currently under reauthorization. Has not passed yet. The programs technically expired on September 30th of 2015. However, our programs do have provisions in them that allow them to continue business as usual until they do come to an agreement on our reauthorization. Just some things to know about what's being considered is that they're not looking at as broad scope of changes as in 2010 in terms of the Healthy Hunger-Free Kids Act. But they are looking more closely at what was passed and those nutrition standards, if any adjustments need to be made. And then there's a lot of discussion about some of the other smaller programs such as summer and things like that, but nothing has officially come down the pipe, hopefully by the end of the year. We did get our fiscal budget for 2015. It does include a 10% increase from last year, so it's a $21.3 billion budget. The increase is primarily due to rising caseloads, so more people are eligible for the program, so that accounts for that 10% increase. And with this omnibus, it allows for states to grant exemptions for whole grain requirements and maintain higher sodium target levels. However, we have not done anything with the sodium target levels. We have started working on granting exemptions for whole grains that have been difficult for schools to get children to accept. And then also there's some state provisions in there about flexibility and how often we come out to do the administrative review. So in the 84th legislature, there was really only two bills that passed that were directly related to the Texas Department of Agriculture. The first one was House Bill 3562 from Representative Thompson, which requires school districts to serve meals to children without positive account balances. This often is referred to as allowing children to charge. Schools have been required to have a charge policy on file with the Texas Department of Agriculture for several years now, but we have always allowed a no charge policy. This bill pretty much makes it where there has to be an ability for the child to charge into the negative balance. The school district has to determine how far into a negative balance, whether that be you're going to allow them to charge for a day, 2 days. You have to determine the time period with which a child can continue to charge meals. And so that is something each school district will have to determine, but the no charge policy will no longer be an allowable policy. The other bill that passed was House Bill 1305 from Representative Bonin, which allows for schools with more than 10% free and reduced participation to serve breakfast outside the school breakfast program. This is just a twist on regulation that had already been there. The prior regulation stated that any school district that had more than 10% free and reduced participation had to operate the school breakfast program. This one now alters that so that if a school district so chose or a school so chose, they could do a self-funded breakfast program. However, they're still required to offer breakfast. Just as an update for the state nutrition policy, formerly known as the Texas Public School Nutrition Policy, some updates were made over the summer to this. We included in that policy that we allow for 6 exempted fundraisers per school campus per school year. This is specific to fundraising. This is not an exemption to the federal nutrition rules called Smart Snacks, but for fundraising, it will allow 6 exempt fundraisers per school campus per school year that do not have to meet the Smart Snacks requirements. Furthermore, because the federal government came out with a federal nutrition policy, the Texas Department of Agriculture has repealed the remaining restrictions that were maintained from the Texas Public School Nutrition Policy, which restricted deep fat frying, the sale of certain carbonated beverages, and the time and place restrictions. We felt that now that we have a federal policy, that we did not want 2 policies overlapping each other, and the federal policy was already more strict in most cases, so we decided that we would repeal the remaining items that we had left there. Procurement, just very briefly, the new super circular that came out from the OMB is some new regulations that a lot of school districts are trying to figure out. This is not EDGAR, which I know a lot of school districts follow EDGAR. EDGAR is something that they incorporate the OMB super circular into. But for the child nutrition program specifically, the biggest things to keep in mind is that it just streamlines where you can go find citations for following procurement regulations, and it offers a new type of procurement for micro-purchasing. We do have resources available on our squaremeals.org website, and we are developing training. I will recommend the Institute for Child Nutrition's Training Procurement for the 21st Century as an excellent resource to learn the procurement guidelines for the child nutrition program. As of July 1st, 2015, the USDA Professional Standards Rule went into effect, which sets continuing education and training requirements for child nutrition staff in school districts, and it varies based on their position. And then it also sets education requirements for those that would fill the child nutrition director role. Again, we are in the process of working with many different entities to get training available that can fulfill the requirements of these continuing education requirements. And then just as a little plug of some things that TDA is doing is that we are working on a Farm Fresh Friday campaign this month. It's almost over, but It is encouraging school districts to incorporate local products into their menus to get more farm fresh products to kids and get them more in touch with agriculture. We've had the Farm to School program for several years now, and we have now started expanding that to farm to summer sites and farm to child care. So we encourage you all to check that out. And that's all I have. So let me turn this back over to Michelle.
Cool. Okay, let me get our next presenter will be Anita. Make sure I have the correct presentation up. And let's there we go.
All right, good morning, everyone. I'm happy to be here this morning again with the Texas Education Agency, Texas Department of Agriculture, and certainly our sponsoring agency, Texas Action for Healthy Kids. One of the things that I'd like to go through just a little bit this morning is a little bit of groundwork because there's a lot of things going on at many different levels, both at the federal level and at the state level. So, Michelle, if you would turn to the next slide, please. I'd like to talk a little bit about the levels of influence, looking at the federal laws such as IDEA 504. There was a law passed that required the Center for Disease Control to write out food allergy guidelines that would be voluntary guidelines. CDC got those out the year after Texas developed their own, and it's really interesting to see that both of those documents look very similar and mirror each other. So you're looking at things going on at the federal level around health services, around food allergy, around different types of laws related to both education and health. And then you drop into the state level where you've got the Texas Education Code, which governs some of the things that go on in schools, the Health and Safety Code that also influences how schools operate, the Occupations Code, which really kind of defines what nursing is. So for those of you in school nursing practice, this is a lot of where you find the information about nursing. And then also the Family Code, because there's so many things in there related to consent and parental engagement and those kinds of things. So you're looking at federal and state laws kind of being the cushion, the foundation. However, you also have to consider that there's local laws that govern things that happen in specific locales, as well as district policies and administrative procedures that have been written, and then professional guidelines and standards that each professional brings into it. So as we talk about legislative update, we really have to kind of look at it from the perspective of a very layered situation to where we at the state agencies try to keep abreast of what's going on at the federal level as well as the state level so that you can be informed, and then it's up to you all to get into the local level policies, procedures, laws, and those kinds of things. So I just wanted to kind of go over that before we kind of jump into some of the things that influence Department of State Health Services this past legislative session. Next slide. This is a document that we update every year or after the legislative session. If you'll note, in the bottom left-hand corner, this was last updated May of 2014. And what this is, it's a selected state and federal school health law document. After this session, we go in and we begin to look at the laws that have passed. But it takes about 6 to 8 months before each one of the websites is updated to reflect the new law. So as you can see, this was last updated May of 2014. We will update it again probably in March, because by that time all of the new code will have been integrated into the websites. And this really kind of helps you go directly to the citation. So you don't have to look everywhere. You can actually go directly to the link. It will take you to the citation. It tells you the topic area on the left, the actual citation in the middle, and then on the right-hand side, it lets you know, whether it's state or federal law. So we hope to keep this document going. If there are things that you see in your practice that are not reflected on this document, please let us know, because this is a living document and we really like for it to be very useful to you. We are going to change its location on the website, so if you'll contact the school health program, we can get you a copy of this. It's better to keep it on your desktop because those links are direct links and it takes you right where you need to go. So we'll be letting you know where this will end up on the website, but please feel free to contact us if you're interested in this document. Next slide, please. This is our document that we put together primarily to keep staff and our agency updated, but it's a very good document in knowing what things have passed. And again, this one was revised for the 2015 legislative session. What is included in this document are those bills that have passed onto law, and there are a few bills that I left on there because they're of great interest. One of them relates to notifying a parent if the school does not have a school nurse. Some of those I leave on there just so I can speak to it later, and usually we put that it didn't pass. If it was vetoed, we put a link to the governor's veto just so that you know exactly why it was vetoed. So this is another document that we have available should you decide you want to use it. It is not a complete document. It doesn't have every single education change or every single health change, but those that seem to have the most impact on school health. Next slide, please. As you can see, some of the bills that we were interested in this session, just a few of them, and the ones that are in bold are those that actually passed. Senate Bill 66 is the one I'm probably going to be spending the most time with today. We are in the process of getting that implemented, and I'll describe that later in my presentation. Senate Bill 265 is a sunscreen bill. That's kind of the short term for saying that students may bring sunscreen and it may be administered on a school campus. Some districts were requiring that they had a doctor's note to administer sunscreen. However, this bill now changes it and states that students may have sunscreen applied during the school day. House Bill 2323, the spinal screening bill, did not pass. And so we are going to be looking at some rule changes on spinal screening this next year. Right now, schools have the option of doing spinal screening in 5th and 8th grade or 6th and 9th grade. So we are looking at developing the rules for spinal screening, and we'd really like public comment. We'd really like your input on those rules once they become developed, primarily because we need to understand how the 9th grade screening is going to impact schools as they begin this next transition. Next slide, please. Another bill that has passed, and I think Barney will speak to this more, is House Bill 2186, which is a requirement for suicide prevention training for certain educators. I'm not going to go into great detail in that because I'm assuming that Barney will kind of give us more of an update on that one as well. And then companion bill, or House Bill 2847 was the companion bill to Senate Bill 66. During the session, there was a bill filed both in the House and the Senate related to food allergy. And so what we're doing is kind of taking the best of everything and putting it into our processes for Senate Bill 66. Next slide, please. So speaking of Senate Bill 66, the law passed during this past session. It requires our agency to put together an advisory committee made up of mostly physicians and at least one RN that works in a school setting. We're in the process of developing the criteria for that advisory committee for those physicians. It was very prescriptive. They wanted somebody, a pediatrician. They wanted folks that treated asthma and allergy, those kinds of things. So we will take those into consideration as we develop the criteria for the advisory. The recommendations, the advisory will then meet, and those recommendations will be sent up to the Commissioner of Health for consideration in the rules. Those rules will be developed in partnership with the Commissioner of Education, and so that process will not only be involving Department of State Health Services, it will be utilizing the Texas Education Agency to help in writing those rules. Now, there's going to be 2 points where it's going to be really important for us to hear from stakeholders, those people who are either impacted by the rule or the laws, or those people who are going to be implementing. And we're going to be doing some activities to get some stakeholder input in an informal way, and that could be through some surveillance, maybe some conversations, conference calls, those kinds of things. The rules will then be adapted or drafted, and we will take all the considerations from the stakeholder group as well as the advisory committee and integrate those into the rules. The rules will then be posted, and this is where formal feedback will be given. And so anytime the rules get posted, we really ask folks to go in and look at them, because this is where we need to make adjustments, and we do it in a very formal way. So once the rules have been posted, we'll send out notices through the Friday Beat and through anyone that we can get those rules posting out to, so that you all have an opportunity to give us some feedback on it. Then the rules will finally be posted, it'll finally be adopted, they'll be posted, and then the implementation will take place. Understanding that Senate Bill 66 is voluntary stock epinephrine. We understand that school districts, some of the districts, are going to be challenged in different ways, and so that's why it's really important that we hear from stakeholders. What are your challenges? What would you like to see in the rules? We want to make it something that the schools can implement without too many problems. Next slide, please.
Anita?
Yes.
It's Barney. Are you going to talk a little bit also about those districts that are wanting to make sure that they're statutorily compliant prior to the rules being developed and posted, and what those districts, any guidance those districts should follow?
We will write that for what Barney was asking. There's a part of the bill that says that if a district already has stock epinephrine, they need to go back and double check to make sure that what they have in policy and procedures matches what the rules say needs to be there. That will be incorporated into, probably not the rules, but we will put that out as part of the process. For districts who already have implemented stock epinephrine, we will notify everyone to say, you know, if you do this, you have to go back and look at the rules. Currently what we're doing is, if the school district is interested in stocking epinephrine this year, we're telling them to go back to the state guidelines, because in those state guidelines we have a section on stock epinephrine, and it's again, a voluntary situation. It's not mandated, but what we wrote into those guidelines is the best evidence-based practice there is, so that if schools want to begin the process, they can look at those as a starting point. Once we get the rules developed, once the rules are finalized, we will go back and update the guide to reflect implementation of Senate Bill 66. Okay, speaking of rules, this is something that just came across my desk, and it will have an impact on schools. Although I did read the rules about communicable diseases, there aren't many changes for schools, but I wanted you to be aware this might be a time for folks to practice in looking at the rules. What you do is you go in, you review the rules, it gives you a contact of who you need to contact about what is written. And so I think this is kind of one of those situations, although there's not going to be a lot of changes for schools, it's primarily just some wording change, but it's not significant. It would give you an example of how to go about the process, where to go and find the rules on the website, how to read them, what they're going to look like. The entire rule is not written, so you kind of have to go back to the administrative code and compare the part of the code and what they're going to revise in that code, but it gives you a little bit of practice, because in that way you can look at something that's actually real and something that you're working with right now. So at this point, I think the next slide is questions, and I think we're going to hold questions to the end. Is that correct, Michelle?
Yeah, I think so, unless there's a clarifying question somebody has. I'm not seeing any right now. So, okay.
All
Thanks,
right,
Anita.
that's what I have.
Awesome.
Thank you.
Change this over to Barney. And then Barney, you just have to hit show my screen. There you
Did
go.
I get it?
You certainly did.
All right. Good morning, ladies and gentlemen. Thank you for joining us today, and great information from our previous presenters from Texas Department of Agriculture, as well as Department of State Health and Human Services. And Anita is correct. I am going to go into a little more depth about House Bill 2186, and while Anita was presenting on hers, she and I had quite a bit of overlap, and so I was making sure to get rid of the slides that she already covered, so I wouldn't keep us here any longer than we needed to be here. So I'm Barney Fudge. I'm the statewide coordinator for health education at the Texas Education Agency, and this is just our little copyright statement here that I'm required by law to post in all presentations. Our curriculum newsletters are posted on the curriculum page, and that's the link up at the top of the page that you can get there. And the spring edition is there, and I want to say that the fall edition has already been posted or is in the process of being approved to post, so make sure that you check out that information. And what I'd like to talk about today are those bills from the 84th legislative session that impact school health or safety somewhat. Also give a little bit of an update on the results from FitnessGram from last year and next steps for this upcoming year. Talk about the school health survey and how many people responded and where you can find that information, as well as give everyone an update on the health education and physical education text review, and then just kind of let everyone know some few changes that have happened to the TEA website. So House Bill 440 actually amended Texas Education Code 28.002 subsection D. And basically what it's saying is that through the required curriculum, which is physical education as part of the required curriculum, that you just make sure that you're making sure that students with disabilities, you're modifying the instruction to include them, as well as students that have the following disabilities, and it's pretty straightforward. It's as simple as that, and I'm sure that there's not a district in the state that's not already doing this. Sometimes I guess people just feel the need to have it codified in law, but I'm sure districts are already currently doing this. House Bill 2186, as Anita's already alluded to, it amended Texas Education Code 21.451, which is actually talks about professional development for educators. And what it basically says is that staff development training must include training that's provided on an annual basis, and it's got to be offered to existing school district and open enrollment charter school educators on a schedule that's been adopted by TEA. It's got to be the training that you use must use best practice-based programs that are recommended by the Department of State Health and Human Services in coordination with the agency. And that link right there in the middle actually takes you to the page where those programs can be found, and that it can also be satisfied through any kind of independent review of a prevention program that complies with the guidelines or is offered online. And this is actually the guidance for this bill and for the statute now actually comes from the State Board for Educator Certification. And there was a to the administrator addressed letter that was sent out to districts on August 26th, and it basically laid out all the guidelines in the bill, where you can locate the information, and then also provided a contact person. So if you have questions pertaining to the changes that were made to 21.451, you would contact Victoria Ellis with the Division of Educator Preparation. And then there's the link to the administrator address letter there at the bottom. So if you click on that, it takes you straight to the correspondence that was sent out. Senate Bill 97 amended a tremendous amount of health and safety code. It was a rather large bill, and it changed a lot of things pertaining to tobacco, because now it's recognizing e-cigarettes in part of that statute. But for our purposes, what applies to us would be Health and Safety Code 161.081, subsection 1-A, and then Texas Education Code 28.004, subsection K, and then Texas Education Code 38.006. And basically, for our purposes, what we need to know is that it defines what an e-cigarette is, and then it adds to what the district's policy is as far as the procedures and penalties of using e-cigarettes, and then information that's also got to be published in the student handbook and on your website if the district has a website, as it pertains to 38.006, which basically says that you've got to have posted that your school district prohibits smoking and the use of tobacco products on all campus property or school property. And now that statement and that signage also needs to include or mention e-cigarettes as part of that as well. Senate Bill 133 amends Health and Safety Code 1001.201 by adding subsections 4 and 5, and then it added a complete section, Health and Safety Code 1001.2015. And basically what it does is it defines what a school district employee is, and defines what a school resource officer is, and allows the Health and Human Services Commission to allocate funds to mental health authorities to continue to offer the mental health first aid training at no cost, I believe. And Anita may have more information on that. Anita, do you have any additional information?
No, I don't. I probably need to check, though.
Senate Bill 382 amends Texas Education Code 21.0541. And again, this is under State Board for Educator Certification. And it basically says that SBEC will adopt rules for educators that are doing professional development or continuing education. Now, if they take training for automated external defibrillators, that training can be used to meet professional development credits. Senate Bill 968 amends Texas Education Code 28.002 by adding subsection W. And basically it says that In adopting the Texas Essential Knowledge and Skills for Health Education, the State Board of Education will adopt texts that address the dangers, causes, consequences, signs, symptoms, and treatment of non-medical use of prescription drugs. The agency must also compile a list of evidence-based programs that we would post on our website, and then a school district may choose a program from that list to implement in a district's middle school, junior high school, or high school health curriculum. And this is currently a work in progress on our end. We don't have a timeline for how this will be implemented yet, and the recommendation was actually made to the agency to possibly wait for this until the Health Texas Essential Knowledge and Skills review and revision comes about, and then actually write the text then that would address this statute that's already been passed. So there's more to come on that one, and we're still, like I said, it's a work in progress. Additional bills of interest that you might think is interesting is House Bill 10, which talks about criminal and civil consequences for the trafficking of persons. House Bill 77 talks about a study of the Dallas Men Against Abuse program. Senate Bill 107 discusses the designation of campus behavior coordinators on public school campuses. And Senate Bill 674 talks about instruction regarding mental health, substance abuse, and youth suicide and educator training programs. And then the link there at the bottom, that's the link to the TEA briefing book. And so you can find information about the bills that are listed here as well as the bills that I've also covered. You can go there for in-depth information on the summaries of those bills as well. Now we'll talk a little bit about FitnessGram. In this past year with FitnessGram, we had 64 districts that submitted through the Physical Fitness Assessment Initiative application, which is the old way from beginning in 2007 on how districts have submitted data to the agency. And then this past year, we received funding for districts to opt in to FitnessGram 10, which is a new web-based application. And we had 996 districts submit data through FitnessGram 10 for a grand total of 1,060 districts. And that's actually the most districts that have submitted data since the 10-11 academic year. We had 1,125 districts that submitted in 10-11, and then this year with 1,060, that's the most that we've had since 10-11. So I was really excited to see that number submitted. And the link there at the bottom of the page is a link to the fitness data webpage where there's information that's posted there about the Texas Youth Fitness Project, and we weren't able to do an individual data analysis this year because of a couple of complications with the system and how data would need to be accessed at the Education Resource Center. But there is an aggregate level study that's posted there on the fitness data webpage that looks at the data or compares the data from 10-11, 11-12, 12-13, and 13-14. And again, it's an aggregate level analysis, but it's the the most up-to-date extensive analysis that's been done in several years. So I would encourage you to go on that web page and look at those documents and look through those to see if those you might see any interesting trends or find anything of benefit to help you make adjustments to your physical education curriculum or your health education curriculum. And for this year, we had Rider 67, which allocated $2 million for the 16-17 biennium, which is actually a reduction from the previous session. The previous session we had $5 million. This year we had $2 million that was allocated, and $500,000 of that up to 500,000 of that could possibly be used for the data analysis part of it, and then any unexpected balances at the end of 16 would then just roll over for 17 to be used then. And we're actually in the contract negotiation process right now with the new vendor. That's why it's taking some time, is it's a new pot of money, it's a new vendor, and so we have to go into a brand new contract and go through all these processes again that we went through 2 years ago. But once we get the groundwork for everything laid now, it should be very smooth in transitioning into the 16-17 academic year, because we would have already done all the work, ahead of time now. So bear with us. I'm hoping that we can get everything wrapped up and have districts able to access the system in the next couple of weeks. With the school health survey, we had 777 districts that reported data, and that's approximately 59.9% of districts that reported. So I was really excited about that, given also the time frame that happened. I had a communication prepared to go out actually in March, which for some unforeseen reason never made it out. So I sent out a listserv message June 3rd, which was the end of school practically for everybody, but we still had 777 responses. And I just want to thank everybody for paying attention to that and taking care of that, particularly during those summer months. And I haven't had time yet to post the survey results or get those up on the website, but that link right there is that's the main page for the Coordinated School Health website. And if you scroll down, it says School Health Survey Results. So that's where the results will be posted, but you can also see the results from the prior years that are posted there as well. And I'll work as soon as I can get the FitnessGram contract in play. I'll try to focus on getting those run and getting those results posted. If you have any questions about the survey, you just email healthandsafety@tea.texas.gov. And with the health and PE text review, there was actually a change in the schedule. We were slated to begin this coming spring, for that review, but the State Board of Education had a kind of a work meeting in March of 2015 this year, and they actually made a revision to that schedule. So the revision now for health and PE isn't scheduled to begin, and again, this is tentative because this schedule could possibly change again as well. But it's not slated to begin until the spring or summer of 2018, which would then put the adoption of the revised text in April of 2019, with the instructional materials review happening in 2019-2020. Professional development would happen in the summer of 2020, and then implementation of the text would actually begin in 2020-2021. So that's the schedule that we're now on for health and PE. But like I said, as the past history has shown, when we get close to this review, sometimes the schedule changes and everything gets moved around. So right now this is what it is, and I call it tentative because there's a possibility that it could change again. And then as far as the TEA website, if you checked out the physical education webpage, we have some FAQs that are posted there now for physical education questions. And then on the health education website, there should be some health FAQs, frequently asked questions, that are also there as well, that I would encourage everyone to go take a look at. And then if you want to join a listserv bulletin for TEA, this is the website that you would go to. You would just go to this website, enter in your email address, click on submit, and then these are all of the distribution lists that you would have access to that are in the curriculum division. You can obviously join any school bulletin list that the agency offers, but these are the ones that predominantly address or that fall within curriculum. And you have health and physical education as one of those, and I think it's listed as school health. I can't remember, but if you want to join the listserv, that's where you would go to join that listserv, and then I open it up for questions. I guess we're all open for questions now, actually.
Yeah, we are actually, but right now I don't have any questions listed. Does anybody out there have questions for our presenters? Thank you so much for the updates on legislation and also how to access some of the great resources you have. I have a question. Can we get the PowerPoints? Most certainly. We will post those. We'll post the video. We also have some handouts from our speakers that we'll share with you as well. So definitely we will do that. Barney, do you want to change that back to my screen?
Yeah, I'm trying to get there.
Might be. So any other questions from any of our participants? Anita, when you shared the information on the different resources, is the School Health Advisory Council information in that same place as far as the citations that link back, and are those listed on that?
Yeah, we have, it's, the TSHAC recommendations and some of their tools and resources are on the website. They're in a different location. But if somebody needs that, if they'll just put in an email to that email address on the slide, we can make sure we direct them to the correct place on the website for whatever materials they might need.
Okay. And then I just, for y'all's information too, Action for Healthy Kids is working on wellness policies, which is something that the Department of Agriculture is also involved in, and they have a new committee that's working on ways to support school districts as you're developing your wellness policies, which play into all the legislation and things you're hearing. So if you're interested in learning more about Action for Healthy Kids work or the wellness policies, you can email me. You can also join Action for Healthy Kids, and you'll get our updates on. We usually have a monthly newsletter and share information on a monthly basis. The PowerPoints, we will email the PowerPoints out to you guys, and they ask if they're going to be posted. We will post the video. We probably won't post the PowerPoints, but we'll post the video, and we'll email out the PowerPoints to the people that have registered.
Jaclyn, are you still with us?
Yes, sir.
I had a question the other day, and I didn't know this might be a good time to discuss with our audience, but I had a service center call in and ask me what the difference was between a wellness policy and a wellness plan. And I kind of assumed that they might be using plan interchangeably as policy, maybe.
Well, the policy is a little bit more generic. It talks more about there's 4 parts to the wellness policy, and under each part it sort of outlines in the policy how they're going, not how, but what goals they're trying to meet under those, or and then the plan is actually a year-to-year. Here are the specific things I'm going to be doing to meet each one of those goals under each of the 4 sections.
Got it. And is that required? Are both of those required of districts?
Yes, the policy is required federally. The plan is inherently required because they have to show us what they've been doing to meet those goals.
Got it. And that's what we assumed, is that you had your policy, and this is what the policy requires, but then your plan is actually how are you going to meet those requirements.
Correct.
Yeah,
Correct.
got it. Okay.
The policy may transcend over years if nothing changes. The plans usually change from year to year.
Got it.
Does anybody else have questions? The next webinar that we'll have with our state agencies and Action for Healthy Kids will be in January, January 12th, and we're currently working on the agenda for that. So if there are specific areas that you would like to have more information on that would help you with your nutrition, physical activity, all the whole child components of making sure that your students are fit, healthy, and ready to learn, please let us know, and we will see how we can best incorporate guest speakers and information that would be helpful to you as you're working with your schools. So if there are no more questions, I guess we're going to call it early. And thanks so much for participating. Thanks, Anita, Barney, and Jaclyn for sharing your time and your resources with us. And we have a great fall and holiday season, and we'll see you guys in 2016.
Thank you, Michelle, for organizing everything.
Sure. My pleasure.